The time right now is 7:32. The Roberto Clemente Plaza in the South Bronx has been closed since mid-July in an attempt to clean up the open-air drug market at the hub. So we're getting a progress update this morning on what's next for that area.
Plus, managing New York's mental health crisis. Big issue for many, right? So joining us this morning is the woman who oversees all of these programs and more, the Deputy Mayor for Health and Human Services, Suzanne Gustave. So thank you so much for being here.
Thank you so much for having me. I can't wait to talk about the programs. We're doing a lot, as you said.
You are
Yes.
certainly doing a lot, right? And so let's talk about public safety, because it's such a big concern, specifically in the Bronx. And we've seen this rise in gun violence in the Bronx as well, which we've talked to many about. But there's a lot of talk right now about the cleaning up of the hub and what is actually happening there. It was a big concern for residents and if it's actually working. So what are you seeing?
So thanks for asking that question. The hub was a real big concern for us. Big priority for the mayor, big priority for the administration. And so what's top of mind for us is to making sure we can surge that neighborhood and others like it with resources that we know they need.
Yeah.
As you know, this scenario is not a new issue. The hub has been a decades-long disinvestment in neighborhoods like the Bronx, South Bronx, and other neighborhoods in the city. So what we have a very innovative program we call Community Link. You might have heard other administrative officials talk about that. So we surged Community Link into that neighborhood, which is a multi-layer, multi-agency effort. We're putting in extra resources for public safety, for sanitation, for Department of Health and Mental Hygiene Services, for substance abuse and mental health services. So when we go and deploy Community Link, we are on the ground, all of us, all of our teams together, assessing what's there and assessing what additional services are needed.
Are you seeing that the open air drug market has decreased? And by decreasing, meaning it's gone away, not just moved a few blocks away?
Yeah, so that was really top of mind for our administration because we did not want just displacement. So we're laser focused on that area, but also looking at the outside areas, the extended areas, especially those parks on the extended parts of the hub. So I would say that we're surging in more resources. So we have placed about $24 million additional into the DOH-MH budget for substance use treatment. So it's community outreach, more interventions, more prevention, and more treatment programs. So we're working with our community members, working with local businesses in the hub, trying to figure out some long-term solutions. So the good thing about Community Link is that we prioritize sustained long-term efforts over short-term enforcement. We're not just there to shut the plaza down and go away. We don't parachute in and come back out. So we're working with community groups, talking to local businesses. We're engaged with the local bid to try to locate businesses in the hub that can accommodate more of our services.
Okay. Well, Congressman Richie Torres was very vocal, saying that he didn't feel like the city was doing enough. He was especially concerned for those businesses and residents who say the quality of life is going down, but also businesses that are losing money. What specifically is being done to help those folks stay in business?
Right. So I think we're actually just talking to people. We're on the ground talking to the bid, and the bid is very invested in us helping infuse that neighborhood with more resources. So I think having extra services for the folks who are challenged and suffering with substance use issues and homelessness issues, right? We're surging not only substance use outreach folks, but also our homeless outreach folks. And there are shelters and a good amount of services in the neighborhood, but we're working with the bid and local businesses to make sure that they feel comfortable with the level of services that we're providing. And as mentioned, people are asking us, when will we open the hub up again? When will we open that plaza again? Well, we're working with our business leaders and our community leaders. When folks feel like there's a consensus that we've made some progress and it is safe for our commuters, that hub is a big transport area, then we'll look at pulling back. But right now we're still surging.
So there no, maybe this year, end of this year?
Hard to tell, but we're going to do it in communication in collaboration with the community.
Let's talk about the mental health crisis. It's so big. It's one of the top issues right now as people head to the ballot box in November, talking about what they're seeing play out in the streets, because crime and mental health go hand in hand right here. And it's bringing us to the conversation about involuntary removals. The mayor's office, as well as you, have talked about the bridge to home process, right? What does that look like? How many people have you actually involuntarily removed and then provide services to?
Right. So I'm so glad you brought up Bridge to Home, because it is really an innovative project for New York City. And that is the model we're looking at. So the involuntary transfers to hospitals for treatment and admission has been a process for New York City for quite some time. The legislation that we got approved in Albany this year, we just clarified the process for New York and what courts have been saying. If we have, and we see people, and the mayor has said this over and over again, if we have our New York City brothers and sisters out on the street who are desperately in need of help, right? They are a danger to themselves because they cannot food, they can't feed themselves or clothe themselves, and they need supports, that we should be able to bring them in for treatment. But what we're seeing is that when we do stabilize our patients and they're ready for discharge, they're not discharged to stable homes. There's still housing instability. And once we stabilize someone and then discharge them to an unstable environment, they decompensate. So our system saw that gap, and now we're filling it. So that is the bridge to home. It is literally a bridge to make sure folks get stable, supportive housing so they can continue their recovery and continue their journey.
Okay, before we let you go, we also wanted to ask you about the Administration for Children's Services, the oversight right there, especially after the death of little Imani Mitchell. Do you feel like there's enough caseworkers right now handling these issues?
So this is such an important issue, and you may know this is close and near to my heart because I spent 10 years at the State Office of Children and Family Services, where we're helping all counties kind of mitigate that risk. But what I will say for New York City, and I can feel it now because I'm now helping them oversee the system, they're innovators and leaders nationally. So and they know how to invest in family supports, and they've invested in the workforce. So our CPS workers have very low caseloads. We went from 9.7 cases per caseworker in 2022 to 7.5 cases per caseworker in 2025. That is way below the national average of 12 cases per caseworker. So what that gives the workforce in New York City is time to really engage with families and to make sure they have the supports they need. We know that if families are well and they're supported, they have economic security and housing stability and health and well-being, then their children are healthy and well and they're safe. So that's what ACS is really focusing on, family supports. But we also know that one child's death is just too much. And there needs to be accountability, there needs to be transparency, and so they're working on all of that. Whenever a child dies in New York City, if the family is associated with ACS within a 10-year span, they go in and do an investigation. And that's on top of what our state counterparts do as an oversight entity. And if there are accountability measures that need to be put in place, they are put in place.
What does that look like? Because I think people hear about ACS quite often, and it's a decades-long problem, not just recent, and saying, well, they haven't been held accountable, and it keeps happening. So what does accountability look like?
So I will tell you that we just launched, because it also goes hand in hand with transparency, we just launched a multidisciplinary review panel that invites outside experts to come into our practice and look at our practice. And if there are gaps, then we fill those gaps programmatically. And if there are corrective actions that need to be implemented, we implement those corrective actions. So, and we're trying to be as transparent and collaborative as possible. And ACS, as I mentioned, they're a national leader. They know that their approach has to be balanced. So they're funding so much prevention and family support. Because as mentioned, if a family is whole and a family is well, that child will be safe. So it's a mix of both.
All right. Deputy Mayor, thank you so much for coming
in this morning.
I appreciate your time.
Thank you so much.